is Talk with Audrey. Welcome back. In a typical year, there are over 17 million surgeries in the U.S., all resulting in a surgical incision wound. As elective surgeries continue to resume, it's critical that surgical incision wounds heal properly. Well, November is Healthy Skin Month, and joining me today is renowned dermatologist Dr. Jeanine Downie. She has more on this really important topic. Welcome, Dr. Downie.
Thank you, Audrey. Thank you so much for having me.
I really appreciate you joining me. You don't really think very often about how long it takes to recover from surgical incision wounds. What's the typical timeline?
So wound healing is complex. Early recovery takes somewhere around 4 to 6 weeks, but it varies. And what I mean by that is it depends on the age of the patient, how long and how wide and how deep and what the surgical incision wound is, and whether the patient has any underlying issues. Do they have diabetes? Do they have autoimmune conditions? All of those things can impact the healing of the wound. So that's why I'm teaming up with Abbott to help people understand that wound healing is more than just skin deep. Now, people can take proactive steps to heal, like prioritizing their nutrition.
How does nutrition help support the healing process?
Well, more calories, proteins, amino acids, vitamins, and minerals are needed to generate new tissue. And actually not getting enough of these nutrients can slow the healing process, which is not what we want, quite frankly. And so that's why I recommend Juven. This is a therapeutic, clinically proven drink by Abbott that has a lot of nutrients, and it helps to enhance collagen formation in as little as 2 weeks. So it's got arginine, glutamine, vitamins, and it helps to support wound healing from the inside out.
That's amazing. In addition to Juven, what else can people do to support the healing process at the surgical incision site after surgery?
So I tell my patients all the time, after a surgical incision, try not to exercise. So I want them to rest up, not lift heavy packages, heavy babies, heavy pets. I want them to not smoke. I tell them to ice regularly because that helps to decrease the inflammation significantly. And they can clean, disinfect, and protect the wound by covering it with Band-Aids to keep the sunlight out, and obviously, Audrey, to keep bacteria out as well.
What about people who are susceptible to keloids?
Well, so what I ask my patients to do, I do a decent amount of skin cancer surgeries, I do earlobe repairs, and I do removal of benign moles as well as removal of significant larger skin cancers in my practice. So many times I'll see the patients back a week to 10 days later. We take the sutures out at that point, and then we as physicians can check the wound healing area and see if the tissue is getting thicker. If it is starting to get thicker, we can inject the area with cortisone, with low-dose Kenalog. We can laser the area, and I give a lot of different wound healing products topically. Antibacterial ointments, I'll give things to fade out the dark spots, and I'll also recommend Juven because of the fact that it's been in over 40 clinical trials, and it's something that's clinically backed, and my patients want to heal faster and want to heal better. But you can actually, especially with frequent follow-up, you can never get the keloid to begin with because the doctor will see it and start injecting and lasering and do what we have to do. And that's why I have so many people referring me, a lot of the plastic surgeons in the area, when they get finished with an arm lift or a breast lift or a tummy tuck, they'll refer the patients to me so that I can help them with the surgical incision site.
Can anyone keloid?
Anyone can keloid. I've actually seen it in my lightest of light patients, Irish, Finnish, Dutch, Danish, and my darkest of dark patients from West Africa. So anyone can keloid, but some people tend to keloid more than other people. And I tell people as a routine, simple things like not picking the areas of your chest. If you have a surgical incision from your heart surgery, obviously the first thing I tell my patients is, I'm happy you're still with us. You've just had heart surgery. But the second thing is to not manipulate, not to scratch at the scar, not to pick or try to pull out the stitches. A lot of people, they go from patients to becoming surgeons, and they want to mess with the surgical incision sites, and I tell them not to do that because that's not the proper thing to do, because that could lead to infection, which quite frankly no one wants.
Absolutely. Well, there's so much to know, but nutrition, again, everyone, is really important when it comes to the healing process. Where can we go, Dr. Downie, for more information?
Absolutely. So I suggest to everybody that they talk to their doctor and see if Juven is right for them. And their doctor can recommend a whole wound healing platform and a program for them. And then they can go to juven.com and know that it's sold on Amazon, and it's also sold out of CVS and Walgreens.
Wonderful. Thank you again for joining me.
Thank you kindly. Have a lovely day.